Good morning and welcome. My name is Dominique McCoy on behalf of the To&Through Project and U Chicago Consortium. I want to welcome you all to today's panel. In case you missed it, or maybe I should say welcome back for the folks that have been kind of sticking with us for these past couple of events. In case you missed it, this is actually the third event that we're hosting in support of our newly released report, Approaching CPS Attainment from a Community Perspective, and the accompanying data tool, which both provide a new look at our understanding of educational equity from the perspective of the 77 community areas of Chicago that CPS students call home. On November 4th, we had our research release event as well, where we dove into the report findings and demonstrated some of the functionality of the new tool. And at the November 9th panel, we hosted what I found to be a particularly insightful discussion between community-based leaders from Teamwork Inglewood, Enlace Chicago, and Build Chicago on how they are leveraging data in their work of supporting CPS students. So I want to quickly share that both of these events were recorded. So if you did miss them and you want to go back and take a look, please feel free to visit our events page to access those recordings. Today's session in many ways aims to kind of push our thinking around how our newly released version of the To&Through Community Milestones tool fits within the larger context of existing citywide efforts to address and repair geographic inequities that we know exist for residents across community areas in Chicago. The To&Through Milestones tool, just to catch anyone up who hasn't got a chance to take a look, for the first time organizes this data on CPS students' attainment by community areas in which they live rather than the schools they attend. And we feel this view of attainment is particularly important to really provide a better understanding of how changes in CPS attainment that have happened over the past decade are affecting students in all community areas, and to provide, I think what we're trying to look at as a starting place to better understand the full lived experiences that are both fueling and limiting success. On the tool, for a given community area, you can do things like explore how high school selection process is being exercised for ninth graders and their families, or look at how college access has changed over time for students living in a given community area. You can also disaggregate metrics like college completion. I think these views are particularly important by things like race and gender, or types of schools that students are enrolling in, to get a better understanding of students' experiences in a given community area. And ultimately, we're hoping this tool can serve as a resource to support, the continued advocacy and strategy of community-based efforts working to support CPS students. However, fundamentally, this project, throughout this project, as a team, we've tried to remain very clear about the fact that, while this data focuses on educational outcomes, it can't be separated from historical and present legacy of segregation that exists across many policy areas in our city, such as healthcare, housing, transportation, community safety, environmental health, economic development, so on, that we know are impacting the full lived experiences of both residents and students across Chicago on a daily basis. We know that to truly make an impact, this data cannot be used in a vacuum. And luckily for us, while this view of education data may be new, the idea of collecting and leveraging community-centered data, elevating community perspectives, and organizing collective impact efforts to improve the lived experiences of communities that bear the brunt of inequities in Chicago is absolutely not new in Chicago, right? So today we've invited three of our friends and colleagues who represent what we see as three distinct examples of how organizations across the city are working to center community-based data in their efforts to build a city that is truly working for all residents. So we're really excited to hear from our three panelists today. Today's panel is going to be a little bit different. We have invited each of our panelists to actually give a short presentation to tell us more about their work and the resources they provide. And then all three panelists will join me for a conversation so that we can talk a little bit about how we see our project making an impact collectively throughout the city, and to respond to your questions that you can submit using the Q&A function at the bottom of your screen. So first up, we'll be hearing from Jennifer Axelrod, Senior Director of Learning and Impact for the Chicago Community Trust, who'll be sharing about recent collective efforts to map Chicago's recovery process from the COVID-19 pandemic. After Jennifer, we'll hear from Dr. Nia Abdullah, Executive Director of MAPS Corps, to share about some of the student community asset mapping that's being done across the city through our organization. And finally, we'll hear from Jake Ament, Director of Neighborhood Network at LIST Chicago, and how his organization supports community-centered quality of life planning process. So with that, I am very excited to kick it over to our first presenter, Jennifer. Feel free to take it away.
Great, thank you so much for having me here. I am really excited to be part of this panel and have leveraged my colleagues' data quite a bit in the work that I've done. I'm also a proud parent of a CPS student, so this work is really close to my heart, both personally and professionally. So when Don asked me to speak, he asked me to share a little bit about the mapping COVID-19 recovery effort. And this effort was really a collective set of work that was started by Angelique Power coming out of the time when she was still with us here in Chicago. And a lot of the themes that I'm going to be talking about in the time that I have, to give a quick overview, there's more slides than I'm going to be sharing today, echo a lot of the themes that Don just talked about, the themes that are in the report, and that my colleagues also are going to be sharing. When we really think about what this report and what these kinds of maps can and cannot do, we're going to unpack that a little bit about who is the individual in the narrative, how do we lift up and move beyond sort of the deficit models, and how can we think about how multiple sources of data contribute to collective dialogue. So this tool was created as a goal of making sure that it was available to the public, so you can go and you can download, you can see all the notes that we have available to you. And it was really created with the idea of how can we make this a dynamic and living tool. It was a set of partners that came from research, philanthropy, nonprofits, and a set of researchers came together to share their expertise across their organizations to talk about how we can make data more accessible. The first part of the slides really we're thinking about how do we do what Dom just said? How do we center who is not showing up in the kinds of maps that are represented here? That we know that many Chicagoans who are invisible in the kinds of data that we have, and most of them are not systematically represented on maps. And so we just want to start that maps are fallible. They have a limited set of data. They tell us some things, but it is an incomplete set of stories. They don't capture, for example, those that are incarcerated or not seeking employment or not getting COVID testing. Now, if you get COVID tested at home, that doesn't show up. Some of our undocumented populations. We also wanted to start out when we did this work, again, thinking about how systemic factors relate to the work of what we saw in COVID, or to the impacts of COVID, that race is a social construct, and we want to acknowledge that up front, and that geographies are not homogenous. So even though we're talking about geographies, just in the way the To&Through report talks about the fact that young people in communities are not homogenous, we wanted to make a sort of similar point here. So as we go through the data, we did want to talk about how we hope these maps were at the initial point of the pandemic and continue to be, to equip people for change, a shared conversation, to think about how investors can be different. And we'll talk about that as one of the key sort of components of what we hope these maps are contributing, as a framework for examining policies and creating new policies, and then opportunities to standardize data collection. We also want to acknowledge flat out that while philanthropy and our data is in here, and it was a sort of a core part of what was the catalyst for this presentation, it is not something that is owned by the philanthropic organizations. And so we want to acknowledge upfront that even though we're going to talk about where philanthropic dollars are going in communities, that we recognize that what philanthropy is and how it's manifested happens every day, all day with community members on the ground. But here's the basic premise of what we wanted to put out. When we first started this presentation, many of you will remember that the initial narrative about COVID and who was getting COVID was an individual failing. People were getting COVID because their own risky behavior, because of their own health issues, was a prevailing narrative that had to be debunked and really highlight the fact that Black, Latinx, low-income frontline workers were getting sicker and dying of COVID more frequently was because of the fact that we have policies and lack of investments that were contributing to that and created that tinderbox. The other key point of this is that we talk about the fact that COVID is the current match. It is not the first match, and it will not be the last match if we don't talk about this and address this as a fundamental truth, and we don't contextualize what the experiences of our youth and residents in the city without talking about this. So again, this was not an accident, and we created them. And the data that we're going to share, and I selected a subset aside to show you, were about what were the creations of those conditions. In order to do this, we created a study area. And so as you go through the slides and download them, you'll see that this study area highlights a set of communities that were 85% or more people of color, that they had low income rates, and that the idea was to help people anchor themselves in the map. So you'll look at where the non-white and white populations are, and these will be consistent across all the maps that you're going to see. What this means is, as you look at it, you'll see that we begin to tell the story that all of you are familiar with, right? We got here as a set of practices and policies that created and stripped wealth and health from communities. So we start by talking about redlining and where populations were not allowed to live or wealth was taken out of housing. We talk about, in those same communities, many of us were working in CPS. I happened to be at CPS at the time, when we closed a number of schools, and we saw it again, they're overwhelmingly falling into those same community areas that we want to talk about. So we're starting to build the case here that all of you are familiar about how this work comes together. So this data is all being shared by people across the community. We also wanted to acknowledge that it's not that there's not investments happening in these communities, and Mia is going to share her incredibly rich asset data, which is the right kind of investment. But what we highlighted here is what are the wrong kinds of investments, that we are spending significantly more money in these communities on policing and incarceration, as opposed to investments in parks and education, healthcare, pharmacies, and schools. So we know that policies got us here. And then we wanted to say we have a choice. And we have a choice in these three areas. We have a choice about how government funding was met. And we started this, and we are in the process of updating this. So this was the initial round of PPP loans. So there was some corrections that were made. But the initial round, you can see, disproportionately skipped the study areas that we're talking about. In contrast, when we look at what suburban Cook County did, they had an equity-driven formula, and we start to see more dollars flowing to the communities that were the hardest hit by COVID. So we can be intentional. We can do this. It takes a level of significant attention, real conversation, and authentic dialogue about what does it mean to be an equity-driven distribution of funds, something that is incredibly important as these new federal funds are coming out. We also want to talk about private sector funding. And I want to acknowledge that there is not a slide that comes after this, because there is a huge gap. We had some private sector people share funding with us. However, the majority of our funding partners did not do that. And finally, just in deference to my colleagues, what we asked our philanthropic partners to do, and as I said, we're updating this, is talk about how shifts were made as a result of funding. So what you see here is where dollars were going by the philanthropic partners who contributed their data prior to, where the grant shifted. So we know that philanthropies can shift money in real time to meet the needs as the community saw them. And now we're following up, because one of the biggest concerns are the shifts that we saw in response to COVID and to the racial justice movement, are they persisting, or are we sliding back? And we need to make sure that as a philanthropic community, we are persisting. So we want to put these maps out so that everyone can see how our data is going. And finally, I just wanted to say that we continue to update this. We encourage you to share your data. The data is available for all of you. And then this is the website, and I believe they also put it in the chat. I'm now going to pass it over to my colleague, Nia Abdullah, who is the head of MapScore, to share her presentation.
Thank you, Jennifer. Can you see my screen, everyone?
Let's go.
All right, so let's get started. Greetings again, and thank you, Jennifer. That was so insightful. It's an honor to have been invited today and share the screen with you and Jake. And I also have a 12th grader in Chicago Public Schools. So I'm Nia Abdul. I hail from the south side of Chicago, and before joining MAPS Corps, I was a CPS math teacher and high school principal. As a leader of majority African American and Hispanic high schools, I saw firsthand my students' lack of high quality, high impact out of school time programming. And growing up on the South Side here in Chicago, I saw the educational disparities between the neighborhood high schools my siblings attended and the selective enrollment school I was fortunate enough to attend. So MAPS Corps identifies the problem that we attempt to address as our underserved youth and under-resourced communities are limited in providing active, productive, hands-on STEM experiential learning and employment. There is a dearth of African American, Hispanic, and Native Hawaiian students entering and persisting in STEM majors and careers. And the crux of today's panel, there is a lack of high-quality community asset data to help inform policy, investing, planning, job seeking, and community decision-making. So MAPS Corps is a nonprofit. We're based on the South Side, and our organization grew out of the South Side Health and Vitality Studies, led by the research lab of Dr. Stacy Lindow at UChicago. Her lab uses an asset-based, community-engaged approach to engineer solutions to injustice. And beginning in 2009, in collaboration with a broad range of community stakeholders and researchers, this work gave life to the MAPS Corps program, now in its 13th year of providing STEM experiential training and high school employment to the youth in Chicago. Our vision is to cultivate scientific minds, healthy people, and invested community residents from the assets of our communities. And our mission is to train youth to produce and analyze high quality data about community assets that everyone can use to improve the human condition. Since 2009, we have expanded from only serving 23 youth to now serving more than 350 every year. We have mapped more than 65 communities and more than 40,000 assets. We train the young people to utilize our MAP app to code and classify data about their community's assets. Young people work in small teams to canvass the public-facing entities in their assigned zip code or neighborhood. They classify the data, administer surveys, and add in notes and pictures of the businesses and organizations. When they're not mapping, they learn our STEM-based curriculum that teaches them how to research the history of their assigned communities. They learn about the redlining that Jennifer just talked about in her presentation, and they analyze collected data to surface and visualize relationships between past policies, community assets, and public health disparities. Once they have collected, analyzed, and visualized our data, MAPS Corps publishes our community asset data annually, and on our website, anyone can search for resources and request data sets. We then disseminate our data to myriad organizations. For example, the mayor's office and other stakeholders are using our summer 2021 data to inform their strategies for combating investment and out of school time programming inequities across the city. And now I'm going to show you the website firsthand. Give me 1 second. All right, so if you go to mapscorps.org and you click on communities, you can view all of the resources here in Chicago that the young people have mapped. You can pick a community. In this case, I'll pick the community that I grew up in, Calumet Heights, and look for what are the fitness options in that community. And as you can see, there are not that many. And then what are the health services in that community? And again, you'll see there are more than we have on the fitness end. But if I were to compare it to another community, say Hyde Park, you can then see what a disparity in those assets are. You can then click on any of the pins and see this is the home healthcare asset that is in that community. This is the address and the phone number, and also when it was last updated in our database. So in this case, it was July 2021. You can also click this button, request data, and ask for data sets. And if you are not using it for commercial use, it is free, and we send these out to myriad organizations and individuals every week to help inform grant making, policy proposals, quality of life plans, things of that sort. So now I'm going to hand it over to Jake Ament, the head of LISC, who is going to talk about his amazing work. 1 second.
Thank you, Nia, and thanks, Dom and the To and Through crew for having me here today. I will correct you, Nia, I'm not the head of LISC. I'm the director of the neighborhood network here, LISC Chicago, so just so in case my boss is listening. But LISC Chicago is part of a nationwide organization that focuses on community development. We're a nonprofit, and we've been around about 42 years, and in Chicago for all but one of those. We work on community development broadly, but really our goal is to work with communities and with residents and partners in communities we serve to forge resilient and inclusive communities of opportunity across America. Great places to live, work, visit, do business, and raise families. So we do that in a variety of ways, and some of those are as an investor. We're basically a nonprofit bank, community development financial institution that invests in projects and communities. We have programs that work with financial opportunity and financial coaching for residents of same communities. We work with small businesses in financing and technical support, and then everything we do is really trying to help build the capacity, collaborations, connections between community-based organizations at the neighborhood level. I am not a professional in the education realm. My background is in policy and planning, although I should say I do have a CPS kindergarten. I'm looking forward to my first parent-teacher conference this afternoon. But we are trying to work with communities, and the program that I really focus on is quality of life planning, to build visions that help leverage the assets that Nia talked about, and get at some of the issues that Jennifer laid out in equity. What the quality of life planning program does is support community-based organizations to convene residents, stakeholders, others in the community, put together a vision and a plan for the community that covers their vision comprehensively for the next 5 or so years. And we've done this with 27 communities across the city. I don't have a tool to show you, but I'll show you real quickly an example of one of those plans. First, just so you can see, and we can put the link in the chat as well if you want to take a closer look. All of those plans that we've helped support communities to create are on our website. You can download them, read them. They're all here going back to the early 2000s. These 27 plans together, and we have 2 more on the way coming out hopefully later this year, have leveraged over $1 billion in investment in community priorities. That's not to say that those are the only dollars going into the community, but really what we are interested in is promoting where that investment is responding to what the community has said their vision is. And then to just take you through one example here in Austin, so these plans have usually a broad advisory group of community stakeholders who've come together and really committed to the process. And then they all cover different topic areas, but usually some combination of education, housing, public safety, economic development might be different in each community. Since we're talking about education and education data here, I'll jump into the education section. I had it a second ago. And so what we work with communities to put together is a goal and a vision for each of those topic areas, and then really to sift through some of the assets data that NIA and MapsCore help bring together, and try to point at sort of priority and meaning for the community. So what are the things that really jump out to community stakeholders? What are the things that they're focused on? And then I think the most important part is really what that means in terms of strategy. So for each of those topic areas, based on sort of the assets in the community, priorities that community members have agreed on, what do we want to take on? And those are usually sort of high-level strategies, and then get developed into more of an action work plan that lays out who's going to focus on this. One of the key factors for quality of life plans is that there is a champion. There is somebody in the community who's going to lead that work forward. Because really sort of back to that goal of what's the community's vision, if there's not someone who's going to keep that focus, they may not be the expert in the community that is able to get all the work done. All of these things are done in collaboration with others, but they're going to be the champion. They're going to keep pushing for it. They're going to make that happen. I'll turn this off right here. A couple of things, just because we're talking about data in this. I think we think about data in a different way, because it's often the qualitative that's more important to us than the quantitative. Not to say quantitative doesn't factor into it, and I realize I'm here on a panel talking about a new quantitative data tool that we're really excited about. But really, where we start is from the knowledge and lived experience of residents and the community stakeholders in the community, to put that vision together. What do we want to see as our future? And more importantly, what are we willing to act on together? So there may be things that community members come together and say, hey, this is important. We really want to make this happen. But it's really not something that we're in a position to take on, and we don't have that local champion. So there may be issues that don't necessarily make it into a quality of life plan, because that's the goal, to bring leadership to it. And to get to that point, I think in a lot of planning processes, data is often a starting point, right? Let's look at what the data tells us, and try to lay out some maps and try to figure out, okay, what should we be doing where? We usually start by supporting a 6 to 12 month engagement and outreach process, because this model relies on getting the right people to the table, making sure that you have a wide, diverse group of stakeholders from the community who can lead the work forward, and that have that sort of breadth of experience across a lot of different areas. So that's the important point for us, is getting that table set. Maybe there's a table that already exists. How do we build it, augment it, and then LISC helps support the organizations at that table with some operating support, with some technical support, with sort of whatever's needed to put a plan together based on their collective vision. So I think the way we think about quantitative data in this process is it can serve a lot of important purposes. And I think particularly having data at a community area level like this tool has is important, because people want to look at what's happening in the community. These are place-based plans. They're focused on the community as a whole, and data can be a motivating factor, right? So there is often an issue that everyone sort of brings up, hey, here's the thing we want to work on. But if we have that one statistic, that can help us sort of build the case, and everybody comes around and say, yeah, we really need to up our, third grade reading levels. The other way is to understand sort of who shares your experience. So we support these plans across the city in lots of different neighborhoods. It's helpful to sometimes go into data like this to be able to say, hey, the conditions that often may be seen may be very similar to another neighborhood. And so that's a neighborhood you want to connect with. They might be allies in pushing for systems change. They might also just have ideas of things that they've tried and learn from. And then I think the main point for data and a lot of this is just you need the numbers to be able to get the funding. So if you want to go to philanthropy, if you want to go to city government, you need to be able to back up. Here's why we think this is important. here's why it's a key issue for our community. We have at times asked for subject matter experts to sort of get involved in the front end. And we've had some meetings where, as the community members are getting ready to plan, their eyes glaze over as we go through a long data presentation. But when we get back to what's really pushing you, that's where the energy comes. That's where that excitement and the collaboration comes together. So we tend to start there and then say, okay, hey, let's bring in some more subject matter experts. Let's bring in some data to figure out, okay, how do we tell that story in data? So so that's quality of life planning. I'll stop there, and Dom, I'll hand it back to you.
Awesome. Thank you all so much. Let me invite back all of our panelists. That thank you is for, first and foremost, the work that you all do. Just appreciate you all just sharing more and sharing all of those resources and information. And that thank you is also for trying to do it in the 7 minutes that I gave you. That is a Herculean effort. That was fantastic. Thank you all so much. So we got some time left to have just a bit of a conversation together. And I think to start us off, I also just want to note, we have some questions coming in from the audience. Please keep those coming. We definitely want to get to those. But just to start us off, when we met before this call and kind of had our first conversations, one thing that just consistently came up is, we all have, exciting new resources, reports that we're looking at, but I think we all touched on the importance of having these conversations both across policy areas and in a way that provides some semblance of coherence, right? Recognizing that all of this is incredibly complex and complicated. So, I think would like to just start us off with, when we think about coherent efforts or coherency of using this data and some of these resources, what do you see as some of the kind of barriers that exist, but also some of those opportunities to try to develop some of these more coherent efforts? Anybody can start if you want.
I can start. I'm the new kid on the block, but so I think the biggest barrier is that there are so many amazing organizations and they're working in isolation sometimes. And so that lack of coherency can be a barrier, obviously. But the opportunity is that because there are so many amazing organizations and there are large grant opportunities from NIHS, Advancing Cities, and SF to bring organizations across sectors together. And there are it's specific NSF focused on racial equity, and they want community-based organizations involved authentically in the work. So that's an amazing opportunity. The work that the trust is doing, bringing so many folks all together. And then in Austin, there are a number of researchers from Northwestern and DePaul, along with the Chicago Park District, the Chicago Public Libraries, all coming together to understand the assets in the community, all the data around the public health disparities impacting that community, and then looking to each other and all of the CBOs in that community to help to build out solutions and asset revitalization and things of that sort. So I think that's an amazing opportunity.
I'll chime in, and I have to admit, I think I'm taking off my MAPID COVID hat and thinking a little bit more about the work I do every day. So I'm sorry about that, but it's hard to separate the two. To augment what Neil was saying, I think there's a couple of other barriers that I would add. One is speaking from a philanthropy point of view, we're talking about systems and policy change. And that is long-term, hard work. And we often focus on the things that we can measure, like did the policy pass and how many, but that says nothing about the implementation or how it plays out in communities. So I think part of it is how do we build for the long term, the kinds of data and the questions that we need to ask to make sure that we continue to understand not only what is the policy upfront, but how is it being implemented and is it being is it having the positive benefits for whom? And asking the question, is it benefiting the people that it was designed to do, and holding ourselves accountable? A couple of things I would say that all of us know on this call, right? The lags in publicly available data that is cheaper for people to access are very long and can really, and it puts people into boxes about what is meaningful. Really important data. We need context, we need change over time, but it's not nimble data. So the thing about MapScore and some other, and those data that lists use, and we talk about community storytelling, is that's more nimble. It can talk about what do we see, what are the early levers, and how do we lift up more and more of that data, because that's the data that's going to help us understand what we see over time. Another piece of that's a barrier, I think, and potentially an opportunity is who gets to access private data. This is sort of a big push for me, is people are collecting data on us and our communities all the time, and yet we can't access it back. It's incredibly expensive. It's not accessible to the communities for whom the data is being collected on. So how do we work with our private sector partners, and even to some degree our public and philanthropic partners, to be more transparent about their data and make it more accessible? So again, more nimble, more real-time data to complement what's happening right now. I think the opportunity is a couple of things. One, I think we all recognize the limitations and power of quantitative data. It is both important, it is necessary, but not sufficient. And I think that's what we've all been talking about today. I think we're all pushing to say that what we can measure in quantitative data is maybe measurable, but not meaningful. And how do we push ourselves to make sure that it is both measurable and meaningful? And the fact that we now, I think, no longer talk about data as quant, but data is both qualitative, the stories, the narratives, the humans that are making up those numbers, and the numbers that then we can report. So I think there's some real shifts in how we think about it, but some real barriers still that limit the ability for people to use data that's the most meaningful for them in order to make the changes that they want to. And, you know, obviously we ask for data, and that creates fragmentation in systems as well. So just want to go ahead and acknowledge that.
And I just want to echo that last point and expand a little, that I do think it's sort of where can you find the meaningful data and do it easily. I think since we're working mostly with community-based organizations, it's really helpful to have something that you can actually look at and track your progress year after year. We're doing a lot of work. Like, do we see the change we're hoping to see? The real answer to that is usually, do the folks involved, do the community members that we're working with feel it, right? And then that will tell us yes or no. But it's nice to be able to, that it takes a while to happen. But I think what's both sort of a barrier and could be an opportunity is that even the sort of simplest web-based tool we can put together is only as good as it being used, right? And so what we hear a lot from our partners is, to the extent that there are folks, and I've seen you guys do this at To&Through as you kind of rolled out this tool, work with some community-based organizations to help sort of run through it, figure out, well, like, so what does this mean to you? What's the story you're looking to tell, and can we tell it with this? And that's often what those nonprofits are looking for, right? Like, I need somebody, I need a person who can help me do this in addition to the data.
Appreciate that. Seen a question come here. I love, Jennifer, what you said about kind of nimble data, and I think opportunities to really develop that nimble data that we can kind of use on a more regular basis. One question that came in here that I want to share is just thinking about education leaders, teachers, principals, also researchers, right? What are opportunities to help facilitate and engage in data collection or communication, among local community partners or families or other stakeholders at community level?
Since I work with the young people directly, I can go first. So this summer, MapScore worked with about 12 community-based organizations, and they hired the young people to do boots on the ground physical asset mapping in their communities. And so what that does is help to use the students' expertise of their own hood, of their own neighborhood, and then center community data and public health data and public policy research to help them to understand disparities across communities, help them understand the history, and so how their community evolved into where it is now. Was it redlining, greenlining, anything transportation ads or deficits, and help them create 14 public health policy proposals. And in the process, they learn how to do research, how to classify data using a taxonomy, and that's a key science skill. They learned how to analyze the data, visualize it, clean it, and then how to understand how public health outcomes have been impacted by the lack of assets in their community. So that's how we can sort of center the young people's own expertise, add in some college and career readiness, and then also help them to go into their communities and help to advocate for what their communities need. So that's my little take.
I have a quick add on to that, which is one of the things that I think all of us are saying is that data unto itself doesn't mean anything, right? It is the meaning-making process that allows data to have impact. And so if you're talking about how do you, as educators, I am a school psychologist by training, so spend a lot of time doing direct service in schools. How do we think about that? We talk about how do we engage in meaning-making. So there are opportunities every day to take the kind of data that we're talking about and help people understand how owning that and being involved in the process is giving it has an agency piece. I'm sorry, I was just on a conversation, listening to a conversation about the people's map and the redistricting, and it all plays into place. Like if we don't understand why data impacts us, if we don't think about and we just accept for the fact that it's an hour on the red line to get from my house to my job, but that's data. What does that tell us? How does it help us understand where jobs are located? What are the differences between communities, and how can that help us rally? So I think there's lots of opportunities to use everyday context, to have real conversations, to talk about what we're experiencing, and to help people see how this actually influences their everyday life, and therefore hopefully can help contribute to evolving the data so it becomes more and more meaningful to people.
Absolutely. One thing I want to circle back on, and I think Jennifer, we'll start with you since you brought it up. You know, in my experience, my background's in education. You know, I don't have a lot of opportunities to always directly engage the private sector, particularly around conversations of, you know, increasing equity in the city. And so, but I think in all cases in your all's work, you know, you have some opportunities, right, to engage the private sector. So, what do you see as the role that, you know, more private entities have in you know, these conversations of increasing equity around the city, and yeah, what opportunities do you think exist? So
I think it's almost limitless when you ask me what opportunities exist in terms of what the role of the private sector can be. You know, I have the opportunity to support, and the trust does support sort of two larger efforts. One is We Rise Together, which is our community Build Back Better approach that we're really thinking about how do we distribute funds and work with communities to build and leverage place-based assets, but also working with philanthropic partners and the government to think about how do we bring all those together. And there's a really powerful opportunity to think about what are your policies, practices, and locations. How are you engaging people so that it moves private sector beyond what's your corporate philanthropy to how are you thinking about equity-driven investments in communities by who do you hire? How are you talking about that? Who are you promoting and sharing that? So, you know, businesses here have a huge part to play in looking at their data, making it more, I am always encouraging people to make it more available. The Corporate Coalition is another big effort that's happening in the city. Again, bringing together multiple corporate partners to think about how they can and what is their role in advancing equity, putting out more data, moving again from philanthropic investments to corporate investments. And so I think there's a lot of opportunity there. And also, again, to give data back to their community to make sure that they're helping us understand what data they have and helping us understand those sort of nimble levers of change. So lots of opportunities there. And And I think, it gets to that accountability and transparency piece that we've been talking about all the way through.
Yeah, I would add another way that I think, we've tried to figure out, and I think lots of folks are trying to figure this out too, is that the private sector is making money in all neighborhoods of Chicago, right? There is active economy all over the place, but I don't know as that is in conversation with how communities are thinking about development too. So what is if you're a private company and you're saying, okay, I'm looking at my sales in these different parts of the city. What could my sales be in this place if there was more investment that maybe we could also help advocate with government and others? And I think that's what we hear a lot from our community-based partners, is that they often feel like the private sector is a little short-sighted. It's sort of, what can I do this month? And part of that is just how our economy works, right? But what could be the opportunity 2 or 3 years from now if there was some investment? There's as we focus on economic development, that often just has to happen via the private sector. That is how the American economy works. But how do we change those from kind of short-term opportunities to longer-term opportunities, and think about like where we're already looking at things we might be doing in schools, things we might be doing in terms of real estate investments. What will that mean for your business model, 3 years from now? And they have all the data to answer that question. We don't.
Absolutely. I see Nia pulling double duty here, answering questions by chat and live. I appreciate it. I actually want to pull out a little bit of your answer. So a question that did come in is, this conversation, this project, is really focused. We do a lot of work around high school and college attainment that we feel is incredibly important. For making sure that students that are interested are, achieving their dreams, having access to opportunities that come with that process. What do you all see as your organization's roles? And you may have to take your hats off of some of these particular projects again, right? What do you see as your organization's roles in helping use some of this data, these processes to increase attainment around these milestones? And how do you think your organizations can help or help? Yeah, you can start since you.
So I think the work being done in Austin and a lot of other of the my future communities is helping to identify like what is the learning ecosystem in that community. And do children have access to out of school time programming that can help with attainment? Schools, I was a principal, cannot do it all themselves. It takes a village to help to close these educational debts that our young people have. And so bringing more high impact out of school time programming into your high schools, into the libraries in your communities, so that the young people do not have to leave their community to get a good education and to get high impact after school and Saturday programming. If you're middle class, you know that you have parents who can help you with homework at home, especially the math and science. You have access to tutors, hopefully have access to a great high school and elementary school, and you have out of school time programs. That's missing in so many of our communities. And so collectively, we all have to work together to bring that into the community. And so MAPS Corps does our little part. We have expanded to after school programming in Bronzeville, about to start in Woodlawn and also Austin. And the idea is to pay the young people who we know need a job to focus on their academic growth and to not have to take the job at McDonald's in order to meet their basic needs. And so that's our small part, but we're looking to expand if anyone is interested. Shameless plug.
That's an important plug. I think similar for us, I echo all of Nia's points on sort of schools can only do so much, and then there's so much that needs to happen outside of the walls of the school. And I think educators are trying to figure that out, but they've got to worry about what happens all day at school. So the quality of life plans are often a way that you can set up that conversation. Same as the Cities My Child, My Future campaign that we're helping work on too. I think the more that there can be those conversations where we're just trying to figure out like what are youth in the community experiencing, what are the sort of holistic needs, and kind of trading that information between the nonprofit organizations, which are often working with students out of school, and educators. But I think more importantly, a lot of the driving force in like education committees or youth committees and quality of life plans is an organized group of parents. And they have a pretty good handle usually on what needs to happen. And it's not usually just, hey, here's what CPS needs to do. You know, they got a request for parks, they got a request for local businesses, that, you know, there's sort of a holistic approach to it. Unfortunately, that's not how public budgeting works. So when it comes to sort of programs rolling out, it tends to be a little bit siloed by where those levers and resources are. So I think having that kind of conversation and setting out some more comprehensive goals can push folks to say, okay, that's great. That sounds like a good program. It also needs to be combined with this agency doing this and this agency doing this. And we need that all to happen at once, because otherwise we're just going to be sort of passing the ball around and saying, well, we didn't do that part. We didn't do that part.
So when I think about what, and again, putting mapping COVID aside and talking more about what philanthropy can do and what the trust can do in specific, because we are focused on closing the racial and ethnic wealth gap in the region. Really thinking about, for us, we're thinking about what are the economic barriers that are impacting families that are then being translated into their children. And so how do we help family members, communities thrive so that teachers can focus on teaching and kids can focus on learning? And so we're really trying to think about, do people have ways of developing equity in their house so they feel more financially secure? Are they staying stably housed? Are there quality living wage, economic dignity jobs for families in communities that allow them to do that? So we're thinking about what are the economic drivers that are then impacting the social determinants of health that are impacting kids' outcomes in schools and teachers who often live in the same communities, right? So when we're thinking about what that looks like, that's one way I think we're trying to tackle the educational outcomes in the city. Another way I think is that we can, as a community, bring people together. We can help build coalition, we can help continue coalition, and make sure that we have sustained focus and intention on things so that we don't lose sight of what's really powerful and meaningful for communities, and we continue to invest in that in the long term.
Absolutely. You're coming up on time. So I think we will call it there. Before we go, just want to say, just publicly on behalf of our team, thank you specifically to you three and the work that you've been doing. Each of your projects that you talked about today really inspired and helped focus our team as we went through the process of building out this report and this tool. It's still ongoing, so just thank you for your leadership, for some of that inspiration, and thank you for joining us today. I'm really excited to continue to think about ways that we can continue to partner together and again, figure out ways we can align our efforts on behalf of CPS students. So appreciate you all very much for joining us. Thank you everyone in our virtual audience for joining the conversation as well. Again, there are links all in the chat around resources that we talked about today. So just appreciate everyone coming out and looking forward to continuing the conversation at future events. Take care.